I was inspired to a big degree by my grandfather. He was a professor of cardiology. He is not only as a medical person, when he was a little at the age of 8, he was involved in the accident. He had the high amputation of his leg when he accidentally got under the train. So his life was not easy. And he came from the countryside of not completely, how to say, stable family. And he made all of his way through, and he's become a doctor. And through the Second World War in Ukraine, he saved lives or deportation to Germany of a lot of people. And then further on, he did his PhD. He's become a professor of medicine. He was a dean of medicine at one of the medical universities in Ukraine, in Poltava. And his influence as a person, his life pathway, his demonstration to me that things are possible even with someone who had this injury and, if you like, disadvantage really through his entire life. He was really transferring on one leg, and he still achieved so much. Certainly they were pioneers of the surgery, and in Ukraine there was a heart surgeon, Professor Amus. He wrote the books about his career, where he started, and how the heart surgery was and lung surgery was developing in Ukraine. And he was a very straightforward person, and I came to see him a couple of times through his presentations in the major clinics of Ukraine, and that influenced me to a great degree. The way people live their lives, facing a lot of problems, a lot of obstacles, and I always respected people who would continue going through them, and that's what I tell myself, not to give up. Obstacles in your profession, in developing new operations and pushing for new operations for the benefit of patients, just to keep going. And then later on, when I came to Australia, again, I was influenced by a number of the doctors, both physicians and surgeons, and not only the way they treat the patients as medical practitioners, but the way they treat the patients as human beings. And I owe a lot to people who respected the patients and taught me and showed how I should behave with the patients. And at the same time, I always saw the examples of the opposite, when the treatment or management of the patients might have not the best. It happens everywhere. And I made my conclusions to avoid this or to do something else differently, both in management of the patients as humans and managing them medically, surgically. You learn how to do things and how not to do things as well. That's how I shaped myself.